Okay, so this is my second technique for the custom healing cap right after placing an implant. Um, you can find the link to the first technique, which requires an internal pickup, in my description below. And this is an upgraded version of it where if you have placed the implant and if you can take a scan like this right after placing the implant, this is how you can create a custom healing cap that does not require a pickup, but rather just a tie base that the healing cap would be glued to. So let's get started. The only two things you'll need is a pre-operative, pre-extracted case scan and the scan after the implant was placed. This is a test sample. However, you could basically just use any case, anterior or posterior. The technique remains the same. Let's go ahead and click next. So the first thing that we want to do is hop right into the expert mode, right click and extract it virtually. Just like in the first technique, we do this because exocad does a wonderful job trying to preserve the anatomy of the gingiva after the extraction. It gets the margins almost perfect. However, sometimes you may need to modify it slightly, which we will do so in this case. So what it's doing right now is extracting the tooth from or separating the tooth from the jaw scan. We'll give it a few seconds for it to let it process. And once it's done, we will verify the margins ourselves. So I will likely extend it to some extent. So I'll go ahead and toggle back into the margin mode and just push this in a little bit more right there to get an even more perfect margin. That looks pretty good. We can do the same on the inside. If it's not perfect anywhere, just go ahead and get it in so it does come out really close to perfect. You can also control click to add more points in between if you require to. And I think that's a pretty good margin. So let's go ahead and hit apply. So it will go ahead and reapply those settings for us. Now, in all reality, if you do this enough, you can get all of this done in a matter of minutes. You could go ahead and print this healing cap on a 3D printer in 10 minutes or under usually. And we'll go ahead and click OK. All right. So now what we have is our virtually extracted tooth and our scan body. Let's hop back into the wizard mode, and in this case, I'm just using a Des Megagen tie base with a 2mm cuff, and it is an engaging abutment. And we'll click next, and click best fit matching, and let's go ahead. And so what we have is our jaw scan and our tie base. Now, this is the part that takes a lot of time to do clinically. We are basically marking the extent of our custom healing cap. So this looks like a pretty good outline of what I would want it to be. If you did want to correct it to some extent, you could do so just by doing this. Now, the reason we're doing this is we're telling Exocad the outline or the periphery of the custom healing cap, and it's going to use that outline to create an emergence profile. Now, the really cool thing about this feature is, and we don't really care exactly where the tooth is placed as long as it's close enough because we will be smoothing it down. But let's go ahead and go back to the abutment bottom. So this is the coolest part about using digital technology. Not only can you preserve the periphery of the margins of your healing cap, you can also customize the way this will be shaped. So you see the top angle and the bottom angle. One side is more convex, one side is more concave. So you can actually play around with the settings on figuring out what works best for you. But typically you want to have a concave surface like so. So this looks like a perfect concave surface. And the other thing that we'll be making sure is it actually did follow the outline exactly where we wanted to. Sometimes it will not. And we can add some control points here. So I'm going to hit control and add a few points, go back into the jaw and just drag it to wherever our outline is. Now, because the control points are pink versus green, you will always be touching the margin periphery at all times. So that's really great. And again, let's make it a little translucent so you can appreciate the anatomy. But this is really the most important part about it. Oh, I actually also do like the height of this border to be flush. If you prefer it to be zero point 0.2 or higher, you could leave it to whatever height you like. I personally just like it to be flush, and that's just a personal preference. Now, what we'll be doing is we'll go ahead and smoothen this crown down significantly so it resembles a healing cap. So we can just go ahead and smoothen this cap down, and we have our custom healing cap ready. You could make changes to it the way you like it. You could just shape it. You can put a label to it if you did want to put a label on it. In this case, let's go ahead and just quickly add a label text, and we'll just call it the Desai Custom Healing Cap. Thickness and size all the way down to 0. And we'll just snap it on right there. And there you have it. The software is automatically going to punch a hole. We don't need to make any gingerbread design. And this is the software punching the hole. And there you have it. So you have a custom healing cap that can be printed on a 3D printer for about in about 10 minutes. And all you really have to do is insert your tie base in it and you are good to go. You can also preserve this design file so you can copy the emergence profile that you have just designed onto your final restoration. In fact, you already have all the information for your final crown to be made because your tissue will heal exactly to the shape of this. You may just have some mesial migration of the adjacent teeth, but other than that, we have the jaw, we have the bite most of the times, and we have the scan. So this is all we really need to make it. And this just makes your implant practice a lot more predictable, and it's just a lot easier to carry out the delivery appointments. I hope you like it, and if you did like the technique, please do share with your friends. Thank you.